Hi everyone, welcome back. The topic for this video is the calf muscles, and I'm going to be talking about basically common injuries in calf muscles, what causes them, who is at risk, what the symptoms are, and how you can treat them and prevent them. As well as I will at the end be giving some basic calf exercises that you can do to stretch out the calf muscles and help ease tension in this area. So the main bulk of the calf is comprised of two muscles here. So we've got the gastrocnemius, which is the main superficial muscle, and this tends to be well defined. That's the muscle that if you stand on your toes and you see the sort of calf muscle sticking out, that's the muscle that you're seeing. That is actually responsible not only for plantar flexion of the ankle, so when you're standing up on your toes, but also of flexion of the knee. And so this is why, when people come for a sports massage assessment, I may, observe them, doing a squat. Now, the other muscle, which lies deeper and is kind of mostly covered by the gastrocnemius, is the soleus muscle. Now, the soleus also plantar flexes the ankle, but it has slow twitch type 1 fibres, which are more resistant to fatigue, and so this muscle is used in a lot of endurance sports such as running. Now, everyone has a different genetic predisposition to type 1 and type 2 muscle fibres, and the growth potential will be higher in someone who is more type 2 dominant, because they will be better equipped to do strength strength training. Type 1 dominance is certainly has a higher potential for endurance, so things like marathon running. Type 1 dominant people can still do strength training, but they may have to work harder to achieve the same muscle growth as someone with type 2 dominance. Now, the smaller calf muscles, can easily be missed from a workout, but strong calves really help to balance out your body. They're important for forward propulsion, so particularly in things like running, and also in explosive power movements, both inside and outside the gym. So we could be looking at things like sprinting and cycling. Now, the calf muscles will also help to stabilize the foot when landing. And injuries such as plantar fasciitis and Achilles tendonitis may result from tight calf muscles, which will then limit the ankle mobility. And certainly a common treatment in those two issues is calf massage. Now, the most common exercises in the gym that would use these calf muscles, if you're looking at cardio, we're looking at things like cycling, rowing, stepper, running. Resistance exercises, so you're looking at squats, lunges, deadlifts, leg press, leg curl, and calf raises. Also those power movements, so anything that involves jumping, and sort of in terms of balance, any single leg exercises. So the gastrocnemius and the soleus muscle here, the gastrocnemius, they both merge at the base of the calf, sort of going into the ankle. They merge into this Achilles tendon here that runs down the back of the ankle and inserts into the heel bone. And the calf muscles will pull the heel up to allow forward movement. But this is also why issues such as plantar fasciitis respond well to massage treatment on the calf, because if the calf is tight, it's going to pull on that Achilles tendon, pull in at the heel, which then pulls on the plantar fascia the other side. Now, common calf injuries will always include muscle strains, and there are 3 grades of muscle strain. So we've got grade 1 here, which is basically where the calf muscle is stretched past its normal length and limitations, which results in some muscle fibres being torn. But, generally the muscle remains intact. And so quite often this type of strain may not be noticed until after the activity, when maybe, your calf is aching a little bit more than usual. Now then we have a grade 2 type strain. So the grade 2 involves a partial tear of the muscle. So it involves injury to more muscle fibres than you would see in a grade 1. Localised calf pain is noted during activity, and it will be sore to touch, and certainly may restrict movement somewhat. But the most severe type of strain is a grade 3. Now, grade 3 muscle strain is basically a complete muscle rupture. So the muscle is completely torn, which understandably is going to result in severe pain, bruising, and inability to walk. And the muscle may collapse into a lump, which can be seen and felt through the skin. So what causes these calf strains? Certainly overuse, training too hard, too quickly, or repetitive movements, but also any sudden or abrupt movement, maybe insufficient warm-up or cool down, which is why we always talk about stretching as being so important. Anything where there is a sudden change of direction, or an explosive movement, or sudden increase in speed. So that certainly would be applicable to maybe things like football, or sprinting, or any of these power lifts, but also climbing or running up the hill will certainly pull on those calf muscles a lot more. Another factor is if you have flat feet, for example, you tend to overpronate, which means that the ankles kind of turn inwards. And this quite often will certainly affect how sort of an impact or force is sort of absorbed by the muscle. So yeah, over anything where there's overpronation will just affect the sort of balance in the calf. And also, we talk about it with runners all the time about, regularly changing your footwear to ensure that your feet are fully supported. And that's because inappropriate footwear or unsupportive footwear can also, mean that there's a greater impact, through that calf muscle and through the knee joint. So, in terms of if you actually experience a calf strain, what symptoms, can you expect, to, be present? Obviously, it's going to depend on what grade of muscle strain you have. As we've said, grade 1, you may just feel a bit of an ache after doing some exercise. Grade 3, you're not going to be walking on it. So, depending on the grade, depends on which of these symptoms you will experience. But certainly a sudden sharp pain in the leg, pain or aching around the mid-calf, or on, standing on your toes, pointing your toes, or with resisted plantar flexion. There may be a burning or stabbing sensation, possibly that comes alongside inflammation, and certainly in the grade 3 you're certainly going to probably see some inflammation, and also with grade 3 you will probably feel a palpable lump where that muscle is completely torn and bunched up under the skin. Certainly bruising, again with sort of grades 2 and 3. There's likely to be, a fair bit of bruising, tightness to the muscle, and, restricted movement, certainly difficulty weight bearing with grades 2 and 3. Also with a grade 3 where there is a complete rupture, you will notice an inability to contract that muscle. So quite a range of symptoms. In terms of treatment, early treatment with any kind of sports injury always means a better outcome and prevents, a higher grade strain. So, even with a grade 1, you might think, oh, it's just a bit of an ache, I can push through it. But actually, by doing that, you're running the risk of actually causing a proper tear in the muscle. So it's always best to treat these things, take the appropriate rest time before returning, to activity. So in terms of recovery time, with a grade 1 strain, we're probably looking at approximately 2 weeks. Grade 2 strain, probably 5 to 8 weeks. And a grade 3 strain, recovery time could be up to 3 to 4 months. And again, obviously, it's dependent on how soon, you seek treatment. But in terms of what treatment, you should be, taking, certainly rest to prevent further damage. Power exercises that put excessive strain on, those two main calf muscles certainly need to be avoided for anywhere between 3 days and 3 weeks, while the injury is in that acute stage. But if in the chronic stage, that could be anything from, 3 weeks to 2 years. Also physiotherapy, sports massage, obviously to reduce any tension in the muscle, and just improve the range of motion, improve muscle strength. But again, these things, you're not going to be doing this in the acute stage. You're going to have to wait for any inflammation to subside. Now, in terms of relieving inflammation, you can certainly, using ice packs, 10 to 15 minutes every 2 to 3 hours while in that acute stage. That will help ease inflammation. You don't want to really use them for any longer than that at a time, because you don't want to sort of obviously cause any nerve damage. You can also alternate this with heat packs. So the ice will help reduce inflammation, while the heat packs will then help to relax that muscle and ease tension during the subacute stage. So once the inflammation has started to subside, you may also, depending again on the grade of strain, you may want to look at some sort of compression to help reduce swelling and also restrict movements. That could be something just like a tuber grip or something. In the case of a grade 3 rupture, it may even be that a cast will be used just to stabilise, that lower leg. Also elevation, keeping the leg up to basically help improve lymphatic drainage and aid venous return. We obviously want to help reduce any swelling, but also help improve the circulation so that you've got oxygen and fresh nutrients being brought to the tissues to help them recover and heal. In terms of medication, you may want anti-inflammatories and paracetamol for pain relief. Other things that you may look at are things like orthotics. If you are someone with flat feet where overpronation is an issue, you may just want to look at things like arch supports and shock absorbing insoles, particularly if you're a runner, just to help absorb the impact. Also, kinesiology taping may help with lymphatic drainage, and also with repair of the damaged tissues. In a severe grade 3 rupture, it may even be that surgery could be required, but only in the more severe tears. Now, massage can certainly aid recovery and help improve joint mobility, but as I've said, it shouldn't be used in the acute stage. You must wait until the inflammation has subsided. And to be honest, I don't think many people would want, a massage on it if the pain is still quite bad. As a sports therapist, I can recommend strengthening exercises following the acute inflammatory stage, which you would gradually increase the intensity of those exercises throughout the recovery period. So, what are suitable exercises when you've got a strained calf? So, when a calf muscle is strained, you do need to take a specific exercise approach that accommodates the pain levels but doesn't worsen the injury. And so safe exercises involve anything that doesn't require plantar flexion of the foot, i.e. heels up and pointed toes. Now, it's also important to be aware that, limping due to the injury can cause problems in other areas because other muscles start to overcompensate. So areas such as the lower back or the uninjured leg, those are the areas that are going to start working harder to make up for the injury. So sports massage in these areas during the healing process will probably also help, in terms of relieving pain levels and in terms of preventing further injury. Now, in terms of weight training, obviously a lot of regular gym goers, when they get an injury, the last thing they want is to be out of the gym. But it's just a case of adapting your workout routine and maybe just focusing on some alternative exercises while your calf heals. So exercises that you can look, focus on, that aren't going to sort of damage the calf any further. You can do your bench presses, shoulder presses, which you can do, in a seated position if it's painful to stand. Bicep curls again in a seated position. Back rows, triceps extensions, crunches. Now, in terms of squats and leg presses, leg extensions, they work the thighs and the glutes, but they also use the calf muscles to stabilize. So, this is probably going to be painful. So my advice would be to wait until your pain levels are eased before you start doing these kind of exercises. In terms of cardiovascular exercise, most cardiovascular exercises involve plantar flexion to a certain degree. So, running, walking, cycling, using a stepper, jumping rope, and even swimming requires some. Rowing and cross trainers, however, allow your feet to be planted firmly on supports, and therefore they place less pressure on the calves. So, if you're a cardio person, then I would say focus on rowing and cross trainers where your feet are going to be firmly supported. Now, in terms of corrective and preventive measures, when pain is minimal following a rest period, it's important to gradually strengthen the muscle and increase range of motion in order to lower the risk of any future injury. Because obviously once you've had a strain, you're going to be more at risk of having another one, and you're going to have scar tissue in the muscle as well. Now, these stretches should only be performed to the point of discomfort, and if painful, they should be stopped. But I'm going to show you some stretches now which will help to strengthen and also stabilise the calf. Okay, so good stretches will be, certainly if you're into yoga, a downward dog, certainly gives a good stretch down that calf muscle. You can also do a seated stretch, just bending forward towards your toes, or as far as you can go, as far as the pain allows. Again, we'll stretch down that calf. If you're sort of out and about running in particular, one thing you can do are heel raises and drops on the edge of a step. You can do these at home as well, just literally alternating between pushing the heel down over the edge of a step and then lifting it up and onto your toes. But again, working up onto your toes it's going to be dependent on being out of that acute stage and dependent on pain levels. And certainly, you know, don't rush into it. Another stretch you can do are these heel scoops. So another good one if you've been out running, where you just bend one knee and then push the other leg forward, you know, pushing your heel into the ground and then bending over towards the foot, which again gives a nice stretch along the calf on the straight leg. Now you've also got your basic standing calf stretch, which you can do sort of by balancing up against a wall, you know, or even just sort of holding on to something in front of you, just extending that leg back to give a good stretch again down the calf. Also, you can do these single leg squats, but you know, squats do you know, use the calf a lot, so I would recommend keeping these certainly until pain has subsided. And I would say do some of these other calf exercises first, and then progress on to the single leg squat when you know, when you feel ready to strengthen that calf muscle a little bit more. Now, in terms of you runners out there, I'm going to address you guys, because certainly a high percentage of those clients that I see with a calf strain are often runners. Now, not only does the calf muscle help to, you know, propel us forward and sort of create that sort of spring step, you know, as our foot plants on the ground. The calf muscle also stabilizes the ankle and acts as a shock absorber, you know, of our body weight landing. And if you think that every mile, for example, takes 1,500 strides, any calf weakness or incorrect running technique will increase the stress on those muscles and therefore increase the risk of injury. Now, I'd also, I've mentioned running technique there. I'd also suggest that if there are runners out there watching this, you know, do take a look at the other video I've done on correct running technique, which looks at good posture when you're running in order to prevent injury. Now, calf overload may also occur in runners if the glutes are tight. Now, the glutes will basically pull back and stabilize the hips while running. And you know, this is why if you watch my video on running technique, I talk about engaging the glutes, you know, in order to kind of reduce the impact through the calf and the hip. So yeah, if the glutes are tight, you know, the impact that would normally be taken through the hip will be transmitted, you know, further down the legs. Now, good hip extension is also required for swinging this leg into a forward motion. So if a runner is prone to painful calves or injury there, it may be worth having a sports massage around the hip flexors and the glutes, just to sort of, you know, improve flexibility and strength here. Now, one of the times when calf injuries may also occur is if people adapt to forefoot running too quickly. Now, the calf extends from attachments above the knee down to the Achilles tendon, which attaches at the base of the heel. but if not warmed up properly, then the calf muscle will take more impact and basically overcompensate, for the elasticity of the Achilles tendon, which, the Achilles tendon is very tough and fibrous anyway, but elasticity certainly reduces further with age. So, but as I say, do take a look at the other video on running technique. It will explain why the core muscles are so important for stability when running. It will also look at the role, engaging the glutes in order to stabilize the hips and reduce the impact through the calves. And it will also talk about the, landing position of the foot. And, in terms of propelling forward and how that affects, the knee and the hip. So that is really all your basic information on the calf muscles and how to deal with calf strain when it happens, and some exercises that you can do and ways that you can try to prevent it. I will be doing numerous other videos on various muscle groups. So I'll be doing some on the quads, some on the hamstrings, hip flexors, glutes, arm muscles. So do keep your eye out for those. And if you think you might be interested in those, also, subscribe to my channel and you'll be notified when they come up online. Feel free to comment down below, or you can contact me with any questions through my Instagram or Facebook pages, and I will do my best to answer you as soon as possible. I hope this information has been of some help. But that's really it from me today. So I will see you next time. Bye.